Firstly, patients are really looking for natural results now. They're often asking, saying, please don't give me that frozen look that they can quote certain movie stars that they don't want to look like. Secondly, they are looking for price. But more importantly now, they're aware that the results and the outcomes is very much operator dependent, and they are looking at the skill set of the physician who's injecting them. I think it's important to see your patients 2 weeks after you've treated them. Patients may be happy, but they may not be just perfect. And there is an opportunity there at 2 weeks to just do a minor adjustment with a little bit of a top-up. The flip side is that we are now unfortunately seeing long-term resistance and even some complete failures of treatment with patients as they're having more and more toxin treatments repeatedly over the years. And this has implications medically. For example, if somebody develops a stroke or has other dystonias, gets chronic pain, bladder dystonias, achalasia, all these now, one of the options for treatment is actually just toxin treatment. And if the patient has developed full resistance to the drug, it's just not going to work. Now, why does that happen? We know that it's partially due to the complexing proteins that come with the drug. So if we can choose a drug that has minimal complexing proteins, then the patient is not going to develop resistance. So for those little top-ups, you have that ability if you have no complexing proteins in your drug. The resistance develops. It's basically like a vaccination. When you're a child, you have vaccinations against some very nasty diseases, and you get given part of that actual bacteria and virus that your body will recognise as something that shouldn't be there, and you develop antibodies to it, which is like a memory of your body. So next time it appears, it just knocks it on the head. Well, we have now seen that with botulinum toxin, and our research has shown quite clearly now that it is actually the extra proteins that come with the drug. Yes, and the way we always have done it is not to use top-ups or make our treatments spaced a long time apart, so we minimise the risk of developing it. However, now we have a choice of using a pure toxin that doesn't have the complexing proteins which lead to the resistance. So that gives us, as an aesthetic physician, great flexibility in being able to top up the patients and really hone down and getting a very good individualised treatments. It has a really good pharmaceutical background, and they use a process called chromatography in the laboratory where they actually can precisely remove those proteins and just get it back down to the base pure element of the drug that we need, the botulinum toxin itself. So my experience with using the pure toxin is that it comes on a little bit quicker than the other toxins that are available to us. It lasts just as long, which is fabulous. And it also, a lot of the patients are now requesting it because they don't get the stiffness or tightness or even occasionally a bit of a headache that they do with some of the other drugs that are around. Clinical studies have shown us that developing resistance is not actually related to the dose, which is what you would think logically would be the case. You can develop resistance even if you have a minuscule amount of toxin. It's more related to how frequently you do it. So for patients now who are new patients, especially who are looking for the long term, I advise them to stick with the pure toxin so that they don't develop antibodies and resistance in the long term and treatment failure. And that's so that their aesthetic results can be maintained. However, with my doctor hat on and medically, I'm advising it strongly because you never know, sadly, if one of them needs toxin as a first option for therapeutic indications, such as with having a stroke, chronic pain, or any other serious medical indications.